Hello, welcome to Health Talk. I'm Dr. Manny. The CDC says that in the last 2 years, autism cases have increased by 23%. That's a lot. That means 1 in every 88 children in the U.S. is on the spectrum. There are many theories about treatments out there, but my guest today conducted a study that found food and nutrient sensitivities play a huge role in autistic children. This is Dr. Jacob Teitelbaum, and you know him because he's a regular guest here in Fox News, and he's very well versed in many of these therapies. The last time we talked about the effects of sugar in our nutrition, but certainly this is very important. As you know, I have an autistic child, so this means the world to me. Let's talk about the study, which is the desensitizing technique, right? Tell me about that.
Well, what we're finding is that food sensitivities are playing a major role in triggering the autism. And there's a host of different sensitivities. And we see a lot of allergic symptoms. You know how your son has the gas and will have the bowel symptoms associated with the other autistic symptoms very commonly.
Right.
And we decided to go ahead and treat for these sensitivities using a special, think of it as an acupressure technique that desensitizes the body to one food with each treatment.
Yeah, because I'll give you a prime example, and I'll use, because this is fascinating to me. My son, who, was a lovely boy when he was born, had no difficulties whatsoever. And in my family, we are not really allergic to any kind of food. When he was 1.5 years, he became into contact, just physical contact with a peanut. Mm-hmm. And he almost died. It was not that he got a rash in his face. It was not that he became red. He almost died. Epinephrine, the whole 9 yards. And this came out of nowhere. So I saw that this had to at least be part of the bigger picture. Okay, so how did you break up the study?
Well, what we did, the way we got introduced to it is there was a child that came into our office. And my work is mostly with fibromyalgia and chronic fatigue syndrome treatment.
Right.
But there's a child with autism who is nonverbal. And she came in and had one of these NAET treatments. And she came in after one visit and it was, "Hi, Dr. Teitelbaum, how are you doing this morning?" And he was a chatty Cathy. And my wife and I decided we needed to fund the study. We explored, talked to researchers around the world, found this was a common event. So we went to the NAET Research Foundation. Our foundation funded the study. We got 60 children who had autism, and we randomized them half into treatment, half into non-treatment control group.
Right.
And then what we found, 23 of the 30 kids in the treatment group were back in regular school at the end of 1 year, as opposed to none of the untreated children.
How long did you follow them?
Well, the treatment was for 1 year.
Okay.
So it was twice a week, and they're fairly simple treatments. And you would see the stepwise improvement in most of the children. So some of them would have these dramatic shifts, but most after 20 treatments and then 40, and they'd get better and better. So this was a year out that we did the follow-up. And then at that point, the untreated control group, we treated them as well.
So, a lot of the theories working in the autism spectrum, and I have had many scientists here talk about it. So I guess the argument behind your study is that, look, these children are sensitized to certain particular proteins in food. Mm-hmm. They create an inflammatory response. That inflammatory response kind of confuses the cognitive functionality of the brain. If you eliminate the food allergies, the inflammatory response go down, and the cognitive transmission improves.
Bingo.
That's right. You see how I can put things together. I'm not that dumb. So where do we now move forward? I know you published the study, so it's published and it's out there. What do we say to parents? Coming up out of this, do we say that the food allergies are important?
Well, we know that the food allergies are critical. This treatment is considered a complementary or holistic treatment, so it still is new.
Right.
But it's something that's very gentle and benign. If I was a parent with a child with autism, my child would be getting treated now.
Right.
And there's over 10,000 health practitioners trained worldwide. The website is NAET.com.
Give me a taste of how you desensitize. Let's say if I came to you, and I guess first you do certain allergy tests to see if there's whatever allergy sensitivities the baby has or the child has, or not necessarily.
We can do the testing, but what I prefer is that the child be treated for all of the 50 major food groups, which is what we did in the study.
Okay.
And just each week treat for one of them. And the treatments are simple. They simply hold a vial that has that allergen in it. And you hit several pressure points along the spine. You just gently touch them, and for the acupressure points. In fact, the first time I got in contact with NAET was I had horrible ragweed hay fever allergies. And this gal in town said, I can help you with that. And I said, that voodoo is not going to help my hay fever. Leave me alone.
Right.
You know, and one day I was especially miserable, and she said, stop being a nitwit and let me treat you. And I said, okay.
Right.
And it was like somebody turned off a faucet in my nose. The hay fever went away and never came back. And that's when I started exploring it. But it was a very simple thing. It was simply hitting several pressure points.
And you did this over a week?
You do it, it's a 20-minute treatment. You do it twice a week.
Okay.
In the study.
All right. So, but, so the message is that, look, these allergies can play maybe a role in delaying progression of getting better. Don't give up the ABA or anything like that, but try to absolutely supplement it with something like this.
The message is you want to do a holistic approach. You want to do the cognitive behavioral counseling because these children and the families need help with it. You also want to cut the sugar out of the diet and help clean up the diet a bit. But then the child can't avoid everything in their life. So you do the NAET, desensitize the child. That takes the load off. And like say 23 of the 30 kids back in regular schools. It just blows me away.
Yeah. Well, listen, to me, anybody who is very proactive in finding therapies that could help children with autism, I applaud you. And I thank you for doing the study. And I'm sure that once people watch this, they're going to want more information. So where can they find more information on the study and where they can get therapy like this?
The full study can be seen at www.n like Nancy, A-E-T like Tom.com. So NAET.com.
Right.
And my wife and I were thrilled to do the study. It was a labor of love.
All right. Well, thank you so much for coming to the program and giving us good news. I need good news once in a while. Thank you. Okay. And if you have any health questions, you can email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.